should start. Thank you very much indeed for coming to this webinar, speaking about issues about sensory loss and mental health. Alistair Burns is my name. I'm an old age psychiatrist at the University of Manchester and the director of MICRA. And thanks to everybody for taking part. We've got quite a programme, and so without further ado, I'll pass over to our first speaker. There's a couple of general points just as Chris starts. At the end of the talks, we'll try and unmute everybody if they can put any questions into the chat room, and we'll try our best to reflect any of the questions that people have. And if you could, at that time, I'll unmute everybody. If you could pop yourself off the camera at the moment, that would be very helpful. So if you could switch your videos off, that would be very helpful indeed. And so I think we'll start with Chris now. Great pleasure to invite Chris Plack, who's Chris is Professor of Audiology at University of Manchester and is a pioneer in a number of areas. Has written a number of key papers and edited books on issues of sensory loss. So, Chris, I'll pass to you, if I may, to get us started.
Yeah, well, thank you very much. My screen sharing up. Yes, thank you very much, Alistair, for that introduction, and thank you for inviting me for this give a talk in this seminar series. Obviously very strange times, but it's great to be able to speak to everybody from the comfort of my own home. So let's go, here we are. Okay, so hopefully you should all see the screen now. I'm going to speak for about 15 minutes and just give you a general introduction to age-related hearing loss, the sort of hearing difficulties that people experience as they get older, and particularly their effects on communication, ability to speak, particularly in noisy environments, particularly understand speech in noisy environments. So I'm going to speak about 15 minutes, and then Jenna is going to talk about some rather exciting recent work we've been doing, looking at the effects of hearing loss on things like anxiety and depression, particularly for people who've been isolating under the COVID-19 restrictions. Okay, so as you get older, and I'm sure that many people who reach the age of about sort of 50 or 60 will recognize that their hearing is not quite what it used to be when they were younger. And conventionally in the clinic, we measure this using a technique called pure tone audiometry, and that measures your ability to detect very soft tones at different frequencies. And you measure the sound level or the sound intensity you need to be able to hear, just hear a tone at different frequencies. So this is a sort of typical graph you might get looking at the effects of aging on your ability to detect these quiet tones. And so if you can see my pointer here, for the young listeners in this particular sample, this is a recent study that's just been accepted for publication. The young listeners here have they have low thresholds. That means that they can hear quiet sounds, very quiet sounds. But as you get older, your sensitivity decreases, and so your ability to hear quiet sounds becomes diminished. And you can see that as we go from the younger group to the middle age, the elderly. I'm sorry about the descriptions here. I'm sure most people over the age of 60 wouldn't necessarily regard themselves as elderly, but anyway. As you get older, you can see that the thresholds rise, particularly these very high frequencies. So you tend to lose the ability to hear high frequency sounds as you get older. And another thing that you notice as you get older is that your ability to hear speech decreases. And this is particularly the case. It's not so bad in quiet when there aren't any competing sounds, but in a lot of the environments we find ourselves in, there are competing noises. There might be competing talkers. For example, you might be at a party or at a restaurant and other people are talking at the same time, Or you might be, at a venue where music is playing, for example, or you might be just walking down the street and there might be a lot of traffic noise. And all these environments provide a challenge to the auditory system, because it has to separate out the sounds that it's interested in this case speech, from the sounds from the background sounds. And this is one of the hardest tasks that the auditory system does. Hearing things in quiet isn't that difficult, and computers do pretty well at this, as you know from voice recognition systems, but you chuck in a bit of background noise and suddenly the system falls over. It can't deal with separating out the speech sound from the competing noise. And this is something that really you notice going wrong as you get older. And of course, it's very important for us to be able to have conversations in noisy environments. All of our social interactions involve these sorts, are in these sorts of environments. So here is some data. We have in our group at Manchester, in Manchester Centre for Audiology and Deafness, we've done quite a lot of work with the UK Biobank, which is a huge data set. And one of the measures they have in the Biobank is this test of speech detection in noise, which is called the digit triplet test. And it's very, very simple. Just present 3 digits, say, sort of, you might hear sort of 1, 5, 6 or something like that. And you have to respond what the digits you heard were. So you just use keyboard to respond according to the digits you heard. And then you listen to this in a background noise, and then you find the what's called the signal to noise ratio. So how much above the background noise the speech needs to be for you to be able to hear these digits. And this, there's a huge amount of data in the Biobank from individuals who've done this test. As you see, we've got N equals 165,000 here for this particular study. So it's quite a robust effect. And what you can see here is that as you get older, there's a greater prevalence of listening difficulties. And these are the various sort of categorizations, but basically anything that's insufficient and poor means that you have significantly worse than normal ability to detect these spoken digits in background noise. And so as you get older, up to the age of between 40 and 44, there's only about 5% prevalence of these listening difficulties, but by the time you get to 65 to 69, there's over a 20%. And this just gets worse and worse as you get older, so that most people over the age of 70 have hearing difficulties, and they find it difficult, particularly in these noisy environments. Okay, so I've shown you 2 aspects of diminishing hearing abilities as you get older. So one is that you lose your sensitivity to quiet sounds, and the other is that you lose your ability to separate out speech, to hear out speech in noisy environments. Now, you would have thought that these 2 things would be quite closely related. So if you go into the hearing clinic and you get a hearing test and they say your hearing is worse, you'd have thought that would be closely related to your ability to hear speech in background noise, because these 2 things, you'd have thought they're both measures of the same underlying deficit. But in fact, they don't correlate very well at all. And this is a study published in 2012 by Vermiglio et al. And I won't bother you too much about the precise tests they use, but basically on the x-axis here we have the speech score. So lower numbers here represent better performance. You can detect speech at a lower signal to noise ratio. And then we have the pure tone threshold. This is like the audiometric threshold. So this is a measure of your clinical hearing ability. And high numbers here represent worse performance. So you would expect there to be a very strong relationship, so that good speech perception in noise will be around the bottom left here, and that would be associated with low audiometric thresholds. And similarly, if you were very poor at speech and noise, then that should be high thresholds. But as you can see, the scatter of data points here is very, very broad, and there's no clear relationship, at least in this particular data set. And in fact, when you control for the effects of age, there is no significant relationship in this sample between your hearing ability measured by pure tone audiometry and your ability to detect speech and noise. So the standard clinical tests that are used to measure, to diagnose hearing loss and to fit hearing aids are very poor predictors of what is perhaps the most important listening task that we have as humans, that's detecting speech in noisy environments. Okay, so I'm going to drill down a little bit more and try and tell you a bit about what might be going on to explain this, this lack of relationship. So here is a diagram of the inner ear. It's the cochlea. It's where the vibrations of sound are converted into neural impulses that are carried up the auditory nerve to the brain. And the conversion is done by these things called hair cells. And inner hair cells here, there are about 3,500 of these in each cochlea, each side of the head. They're responsible for converting the vibrations into electrical impulses in the auditory nerve. The outer hair cells have a more subtle function. They actually amplify the vibration of this structure here called the basilar membrane. And that amplification is very important in making us more sensitive to sounds. And when you lose sensitivity to sounds, so when you have a clinical audiogram and it's shown you're not quite sensitive to quiet sounds, that is largely due to damage to these outer hair cells. They're very sensitive to damage, and both their number and their function decrease as you get older. But the inner hair cells, these are the ones that actually convert the vibrations of the basilar membrane into electrical activity that's carried up the auditory nerve to the brain. The outer hair cells actually receive connections from the brain that modifies their behavior. So one of the things that's attracted a great deal of interest recently is the actual connections between the inner hair cells and the auditory nerve fibers. These are called synapses. And it's been shown that both noise exposure and aging, particularly in animal models, they've shown this very, very clearly, that noise exposure and aging cause a loss, quite a dramatic loss, in the connections between inner hair cells and auditory nerve fibers. And so one of the things that's going wrong as you get older is that you're losing these synapses. And these are, both these figures here are from histological studies on human temporal bones. So these are post-mortem human ears. This is just a small study, but this actually shows you these ribbons here. These are the, for those who know about these things, these are the presynaptic structures where the synaptic vesicles are stored. But this is only in 5 individuals, so it's not a huge sample, but you can see there's a trend towards the number of these ribbons to decrease with age. So as the individual gets older, obviously these are measured after they die, so this person died at 89 years old, and they have lost about sort of half their synaptic ribbons across different frequency regions. Different places in the cochlea respond to different frequencies. So this affects everything, the connections across the whole of the length of the cochlea, it seems to be. And here's another diagram. It's a larger sample here, but now they're counting auditory nerve fibers. And you can see there's a decline. These blue circles here show a decline in the number of inner hair cells as you get older, but it's not that great. It's only about a perhaps 20% decline in inner hair cells. So you are losing these inner hair cells in the cochlea as you get older, but there's a much more dramatic decrease in auditory nerve fibers. And this is possibly due to the fact that you've lost these connections. If you lose a synaptic connection, then the auditory nerve fiber is going to atrophy because it's not being stimulated, it's not having the appropriate connections, chemical connections with the hair cell. So there's something going on here that is causing, as you get older, causing a dramatic loss, about 50% loss in auditory nerve fibers over the course of about sort of 80, 90 years of life. Now, we don't do experiments on dead people in our lab. We try and measure some of these same things, going on in living subjects, and we use non-invasive techniques. That is, we don't actually stick electrodes or anything into people as you can do in some animal experiments. We record electrical activity from the head. And so there are various ways of doing this, but you can set up simple, what's called montages, arrangements of electrodes. So perhaps have one behind the ear on a mastoid and one on the high forehead. And you can measure the electric potential between these various points. And that gives you a measure of the electric potential both in the auditory nerve here and right the way through the auditory pathway. This is the brain stem at the top of the spinal cord where some of the early neural processing goes on in the auditory system. So here's a hair cell, and this shows different auditory nerve fibers. Each hair cell has about 10 to 20 auditory nerve fibers attached to it. And then these travel up the auditory nerve to the auditory brainstem. And so you can measure electrical activity. And what you often do is to present a click stimulus, so a very brief impulse. And then you get various pulses of activity as the signal travels up the auditory pathway. So after about 1 to 2 milliseconds, wave 1, so-called, of the auditory brainstem response is actually the response of the auditory nerve. And then when you get up to wave 5, which is quite a prominent one, that's at the rostral brainstem around the inferior colliculi. So using these measures, and this is a recent study just been accepted actually yesterday for journal Hearing Research. And we had this is over, we tested 100 people across the age range from 18 right the way up to 75, I think was the oldest. And what you can see from this diagram, I just want to illustrate that you can measure these quite clearly. This is averaging across the 3 different age groups I showed you previously. But you can see you can get nice, reliable responses. Even in older listeners, you can still get quite a nice reliable response from the auditory nerve. But you can see this response decreases quite dramatically as you get older. Not so much in the later waves. There's a bit of a reduction response in wave 5, which is the rostral brainstem, but in the auditory nerve you can see this big reduction in the amplitude of the response, and that suggests that there's been a loss of nerve fibers or something else which has actually disrupted the production of this response. So we're assuming it's loss of nerve fibers, but it could be a dysfunction of hair cells as well. However, these people all had normal hearing within the standard clinical range. And we actually, when we did the analysis, we controlled for the effects of a clinical hearing loss, and the effect was still quite strong. So as you get older, it seems that you are losing probably some, where you've got a loss of neurons, possibly also a loss in neural functionality that's causing a decrease in the electrophysiological response. So we've also done some, so this is an older study. I just wanted to show you that the previous slide showed you a reduction in the neural response from the auditory nerve. That seems to be quite dramatic. There's also a very dramatic reduction in the ability of neurons in the auditory system to synchronize their firing to a stimulus. This is very important in hearing. One of the ways in which we represent auditory information is because the neurons can synchronize their firing precisely to the periodic fluctuations in the sound waveform. And that is something that we know underlies musical pitch, for example, musical pitch perception, but it's thought to also be important in all types of sound recognition and in separating out sounds from background noise. And so this response we're measuring here is now further upstream. This is now around the level of the inferior colliculus in the brainstem. So we're up in the brain now. We're not quite the cerebral cortex, but we're subcortical. And here we have two age groups. Now these are separated at 40 years of age. So the older group here is above 40 years and the younger group is below 40 years. So even though most people wouldn't regard as 40 as being a particularly advanced age, you can see that these two groups defined in this way, there's a big reduction in their ability to encode these stimuli. So these are the actual neural responses as a function of time. So these are the summed neural responses from the rostral brainstem. And you can see that there's a big reduction, you know, it's almost a factor of 2 reduction in the ability of these neurons to represent these fluctuations of sound. This is for a musical chord, a perfect fifth. So these are, you can see, particularly with the younger age group, you can see you get these sort of periodic patterns of firing in the neural response. These are 2 bursts of the same sound. But you can see that this response is reduced quite dramatically as you get older, for the older group over 40 years old. And here's another study, perhaps not quite so clear cut, where we're just measuring the synchronization just for pure tone. It's a very simple sinusoidal waveform. And you can see that this synchronization decreases as you get older. There are a few younger people who also have a bit of a decrease, but there's quite a strong reduction in your ability, in the ability of nerve fibers to synchronize their firing to these periodic stimuli as the individual gets older. So both these, this is only a sort of very brief snapshot of quite a short talk, but this gives you an idea of the fact that as you get older, it's not just that you have loss of hair cells or damage to hair cells. There's a lot going on in the auditory nervous system that's causing a reduction in response. And I have to say that all these people in this study, in both these electrophysiological studies I showed you, all had clinically normal hearing. Okay, so that then they wouldn't have a diagnosis of a hearing loss, but there's clearly some major neural deficits that are occurring as these individuals get older. So I'm just going to briefly summarize now. Aging associated with a clinical audiometric hearing loss, that's very clear, especially at high frequencies, and also with difficulties understanding speech in noisy environments. But we know that clinical hearing loss is a poor predictor of speech and noise performance. So there are other things going on. And what we think these other things are these what's called subclinical because they're not revealed in the clinical audiogram, neural deficits. And some of these are due to neural loss, but there's also demyelination, a loss of the insulating sheaths around neurons, which we know happens as you get older. And we think that a more sort of nuanced diagnostic approach focused on these neural deficits may provide a clear understanding of the listening difficulties experienced by older people. And just to acknowledge the funders briefly, and I will hand over, I think Alistair is going to now introduce Jenna, who's going to talk a bit about the effects these listening difficulties might have on things we're all worried about, things like sort of depression and anxiety and mood. Right, thank you.
Chris, thank you very much indeed. That was absolutely fascinating. I've got a whole list of questions that I'd like to ask, and as we come on to the next stage, we'll have a chance to that. But as you say, it's a great entree into introducing Dr. Jenna Littlejohn. Jenna's a postdoctoral researcher in the Manchester Centre for Audiology and Deafness. And Jenna, thank you very much for talking to us about some of the specific associations that Chris has just given us has just started to enthusiasm us about. Although, Chris, I'm still reeling from the knowledge that I'm an elderly person, so I'll pick myself up during Jenna's talk. Jenna, over to you.
Thank you. Brilliant. So can everyone see my screen okay?
Yes, we can.
Brilliant. So thanks for the introduction. So yeah, following on from Chris's talk, I'm going to sort of talk a bit more about the specifics of these listening difficulties people have and their effects on mental health and cognitive function, specifically during the social distancing, the pandemic that we're all experiencing or living through right now. A little bit of background. So social distancing in the UK. So we know that the COVID-19 outbreak has caused a worldwide disruption in community and social interactions. And people over the age of 70 who have sort of been postulated as being extremely vulnerable, as well as other vulnerable groups, were expected to shield and limit these face-to-face interactions as much as possible. But in the UK, we know that 50% of people over the age of 70 live alone. And this means that older people must rely on connections outside of their household to have meaningful social interactions, and might particularly be relying on technology such as the phone or internet to aid communication with these wider networks. But to make things worse, and as we've heard through Chris's talk, hearing loss is very prevalent as you get older, and there's lots and lots of different factors that come into this. And we think that in the UK, about 70% of people over the age of 70 have a hearing loss. And so these people have additional difficulties in holding meaningful conversations, potentially using these additional means of contact, such as over the phone and various different technologies. And we already know from some past work that hearing loss is linked to higher rates of loneliness, depression, poor self-esteem, dementia. And one of these theories is through this sort of social isolation pathway. So what we wanted to see is, how is the pandemic particularly affecting people in terms of social distancing? So we know that sort of social isolation is very bad for mental health and cognitive function. So how are people over the age of 70 who have been told to limit face-to-face interactions as much as possible, how are they getting on during the pandemic? So the aims of our research were to understand how this social distancing is affecting people over the age of 70, and particularly whether there's any differences for people with hearing loss. And this was in terms of anxiety, depression, loneliness, and cognitive function. And so what we did was we created an online survey where people could sign up and do the research online. Obviously, we've not been able to do any face-to-face research at the moment. So the hearing loss data that we have, unfortunately, there's no clinical or subclinical tests that Chris was describing, because we haven't actually been able to measure those. So these are based on self-report data. So asking people, do you have any problems with hearing loss? Have you had a previous diagnosis? And also using the SSQ questionnaire, which in some ways might be quite interesting, as Chris sort of alluded to in his talk, that is listening difficulties that people have and people say they have aren't always picked up on the clinical tests. So what the SSQ is really a range of different scenarios, and people report if they have listening difficulties or how good their hearing is in these different situations. And the same thing for anxiety, depression, loneliness, and cognitive function. We asked people, do they have a diagnosis of any of these factors? And then we also measured it using these questionnaires to be able to gauge a level of where people were. And we collected this for baseline data. So this was the data I'm going to present to you now was starting at the beginning of June. So when we were right in the sort of the breadth of this lockdown. And then we have 12-week follow-up data as well, which is just going on at the moment, the data collection, to really see whether we can have a look if hearing loss and social distancing is having an effect on any of these areas that's potentially a lasting effect, and what can we know and what can we learn from it. So the results I'm going to show you briefly now are from the first 90 participants who signed up and did our survey. So we did ask for people over the age of 70, just so we could do this our sort of sample, as we thought, potentially people over the age of 70 are more likely to be shielding, are more likely to be following the guidance more stringently, as they've been directed to at this stage. So we had the average age was about 76, but we did have a couple of people who were 70 in the questionnaire as well. 68% of them were females, and 65% self-reported to having a hearing loss at the time. So pretty much what we would have expected based on people's ages. So just to show you some of our preliminary results. So we asked people about their anxiety levels, and we asked them to take a questionnaire, which is the Generalized Anxiety Disorder Scale, which is a 7-point scale, 7 different questions, and they can rate them of how often they've felt these different scenarios in the past 2 weeks. And we saw actually on average the anxiety levels were quite low in this group, although there was a wider range on it. And what we wanted to know specifically with this question was, is hearing loss, as measured using this questionnaire, listening difficulties, is this associated with greater anxiety during the pandemic? And what we saw was that it was. So participants' anxiety scores increased. So the ranges on these scales are the opposite way around. So it makes it slightly difficult to sort of interpret if you don't know which way the scales are going. So 0 on the anxiety scale means no problems, no problems with anxiety at all, whereas 0 on the SSQ is really poor hearing. So they're flipped the other way around. But what we can see is as anxiety scores increase, so as people got more anxious, that this was associated with a decrease on the SSQ, which was worse hearing. So flipping it on its head, we saw that as hearing loss got worse, towards the lower end of the SSQ, people's anxiety tended to get higher. And although it looks here like we've got an increase in 0.34 points, which doesn't seem a lot, you can have a look at the average score and understanding that SSQ ranges from 0 to 120. So there's actually a lot of variability between perfect hearing and hearing loss. So we can see that actually there will be a big jump between them. So the worse somebody's hearing is, the more anxious they are on this scale. We then looked at the same hearing function and depression. And we saw here that we want to ask the same question: is this associated with greater depression during this pandemic? And we saw that this was sort of even more statistically significant, that again, as hearing loss got worse, the depression scores on this scale increased by even more points, suggesting that during this pandemic, people with poorer hearing are more likely to report higher rates of low mood and depression. Again, we used another scale, the Degenerate loneliness scale, which was just 6 questions, but it's been shown to be really effective in kind of working out people's loneliness levels. And we wanted to see how hearing loss was associated with loneliness during the pandemic. And we saw again that as hearing loss got worse, loneliness got higher. And these things are all for controlling for age, gender and level of education. So we know that it's not due to those factors, it's due to the hearing loss. And then finally, we had a look at the cognitive function. So this was a scale which is patient-perceived cognitive deficit. So the participants would report how they feel their memory is, their concentration is, their mental acuity is in different situations, and how much this interferes with their daily life, if it doesn't. So this was really a quite good scale for participants to self-report how they feel their cognitive function is. We wanted to see once again if hearing loss was associated with lower scores of cognitive function. And again, we saw the same thing. So this is the same way as the hearing now. So perceived cognitive function increased with each increase in SSQ. So you see that as hearing got better, or as people self-reported their hearing was better, so was their cognitive function. So more hearing loss was associated with higher rates or higher reports of cognitive deficits. Again, when we controlled for the age, gender, level of education. So this is all really interesting. So we can see, I'm summarising this then, that hearing loss is associated with greater scores on the anxiety scale, depression scale, loneliness scale, and cognitive deficit scale. So it is, what we were expecting to see. Unfortunately, it looks like people with hearing loss might be even more disadvantaged in these factors during the pandemic. But from these tests, we can't actually infer any causality. So we can't say that just because we see there's association between these factors, that we can say for certain that it's the hearing loss or in fact the pandemic which is causing this association between increased rates of anxiety, depression, and cognitive function. So what we wanted to look at is have these changed during the pandemic. So we'll be sort of trying to measure this change over the 12 weeks when we get the follow-up. But we also can do some preliminary analysis on a potential change during the pandemic, because we did ask the participants if they had a diagnosis of anxiety, depression, cognitive functional memory loss, and they reported whether they did or they didn't. And then we also asked them whether they felt that this had changed. So has your mood changed? Have your anxiety levels changed? Has your memory changed at all during during lockdown? And if so, has it got better? Has it stayed the same, or has it got worse? So I'll just quickly report these findings for you, because this really helps us to understand that we can then have a look at whether there is a difference between people with hearing loss and these factors. So when we asked people if their anxiety levels had changed during the pandemic, we saw that the majority of people, about 60% of people, there was no change in anxiety levels. But about 30% of people thought their anxiety had got a bit worse, or their feelings of anxiety had got a bit worse during the pandemic. And only a couple of people reported that their anxiety levels had actually got better. So what we wanted to do is a slightly different type of analysis, and to have a look at, depending on where you are on this scale for these self-perceived listening difficulties, so how good you think your hearing is, did that affect which group the people were likely to fall into? So what we did was, again, use the same listening difficulties questionnaire, and we saw that this is, I mean, it's a bit harder to interpret because, again, it's grouped rather than looking at comparing the different scales. But basically, the people with hearing loss had an increased chance of going this way on the scale. So they had an increased risk, increased chance of having a negative change in their anxiety levels during the pandemic. Same for depression levels. And again, we saw this was slightly different. So about 65% of people said there was no change in their depression levels during the pandemic. But still, there is a big chunk of people thought their depression had got worse, or their mood, low mood, didn't a diagnosis of depression, but it's all the feelings around low mood. And again, we saw there was a significant difference in the risk and the odds of somebody having a negative change in depression. So again, for each, as hearing loss got worse, so for each increase on this scale of listening difficulties, we saw that they were more likely to have a negative change in depression. So the writing is a little bit confusing because it's the other way around. So we see here for an increase in 1 unit of SSQ, which, if you remember, means better hearing, there's a decrease in the risk of having a negative change. So it's just saying the same thing the other way around. So as your hearing gets better, you're less likely to have felt worse mood during the pandemic. And then finally, we asked the same thing with change in memory. This was, again, 80% of people thought their memory hadn't changed, but about 20% thought their memory got worse during the pandemic. And again, we saw the same pattern, and these were all statistically significant when we controlled, again, for their age, gender, and level of education, that as the hearing loss got worse, they were more likely to be in this group, this negative change in memory during the pandemic. So this is, what we've sort of taken from this is it's really interesting. We can see that people with hearing loss tend to score worse on these tests. So they tend to be, during the pandemic, is kind of all we can say, is that people with hearing loss had greater rates of anxiety, depression, poorer cognitive function, higher loneliness, and they were also, this was associated with the risk of it getting worse during the pandemic. So these are just preliminary results. We're still analysing the data and we're still waiting for some follow-up data, obviously, to see the lasting effects of this or coming out of the pandemic. Is that having any difference? And we also have some qualitative data, which is being analysed at the moment, where we ask people what's been particularly challenging, what's been particularly beneficial. And again, we're going to try and have a look at the differences between people with hearing loss and those with normal hearing function to see if there's anything we can infer from that. You know, have people with hearing loss said that they feel something's been disadvantage or something's been particularly beneficial for them? And this could have really big impact, because it might mean that we can try in the future and promote these strategies or identify what the challenges are to try and reduce loneliness and people with hearing loss, even when we're through this pandemic, as fast as possible. But you know, to be able to help people with hearing loss, because pandemic or not, unfortunately, people with hearing loss tend to be associated with a poorer mental health. So just thank you very much for everybody for listening, and just wanted to acknowledge the funders of the studies. This was DSM, a Cheshire-based charity, and this study was designed with myself and Chris Clack and Professor Anna Benary from the University of Sheffield.
Jenna, thank you very much indeed. That was a fantastic summary of the interaction and reminding us of the importance of the interaction between mental health and anxiety and depression and loss of hearing. So I think that's been a fantastic presentation. Thank you very much, and we look forward to hearing more of the results. So that's the two main presentations that have gone on. Please feel free to post something in the chat. What I might do now, if there's no specific questions, I've got lots of questions, but perhaps we could come to those in a minute or two. Suzanne, would it be possible to put up my slide, please? What I'd like to do just briefly is to go through some of the things that from a national perspective we have been doing about COVID-19 in the last few weeks. Suzanne, are you able to pop up my slide? If not, I'll try and share my screen. Suzanne? Oh yes, here we are. Fantastic. So what I'll do is if you just give me one moment. Excellent. So this is something that we've been doing in the last few weeks in terms of looking at dementia and the pandemic that we've heard from Jenna. One of my jobs is as your National Clinical Director for Dementia at NHS England and NHS Improvement. And we were aware that there were a number of issues. Jenna's mentioned quite a few of them in terms of the isolation and issues about the pandemic that were of particular importance for people with dementia. We know that, for example, there are 850,000 people with dementia in the UK, and Chris and Jenna, if I'm correct, probably about 100,000 who actually have got hearing loss as well. And we know there's a specific association between loss of hearing and the importance of dementia. And the recent Lancet Commission that was published emphasised that in terms of preventable causes of dementia, hearing loss was a significant one. So in terms of the pandemic, the kind of things that we thought we would do would be to try and articulate what some of the key messages could be around looking at dementia. Now, we had what we called the wellbeing pathway for dementia, which we adapted slightly into 6 particular areas. The first was preventing well, and that was really emphasising the importance of maintaining mental and physical well-being during the isolation, Jenna, that you have just highlighted so well. We provided some advice, and with colleagues from the University of Exeter published some information, and the Policy Research Unit, the Frailty Unit at the University of Manchester, led by Chris Todd and colleagues, produced some very good guides, and there's a general guide as well, which MICRA supported, about living well. So even in the midst of a pandemic, which was frightening and worrying for a lot of people, that message of prevention was important. The second was diagnosing well, and this was particularly looking at the diagnosis of dementia. The National Health Service, around the time of lockdown, reorientated itself into preparing for a pandemic. And so activities such as those in memory clinics were essentially wound down and stopped for a while. And so the number of people who were coming forward for a diagnosis, and generally people go to their general practitioner and then are referred to a memory clinic, decreased significantly. We've seen a significant drop, and there could be as many as 30 to 40,000 people over the last 5 or 6 months who normally would have had a diagnosis of dementia are waiting. And in common with many other aspects of the National Health Service, that catch-up at the end of the pandemic is important. In terms of treating well, we were aware that people would have to have access to some of the best treatments available. A particular issue for us was older people with dementia in care homes, perhaps because of difficulties with communication as part of their dementia, not perhaps being able to recognise the need for some of the regimes in terms of hand washing, in terms of isolation. And sometimes that can cause agitation. We know that the environment is very important in terms of promoting agitation. And sometimes the response for the health service was in terms of asking for a sedative drug, sometimes an antipsychotic drug that would have been given to treat agitation. And that was something that we saw a significant increase of that. The fourth was supporting well, and that was in terms of largely carers of people with dementia. We know being a carer is a tremendous strain, and Jenna, as you articulated during the pandemic, many of the support services led to isolation. I see many people with dementia, and we know that carers themselves can already feel isolated, and the enforced isolation as part of the pandemic accentuated that. Also, many of the face-to-face contacts that dementia advisors, Admiral nurses and carers had were not as available, and so making sure that support was, as far as we could, being available for people with dementia was important. The fifth was living well, which was as much as we could maintain that lived experience for people with dementia. That is, in terms of living well, that's as much a response that the society has to people with dementia. And Chris, the example that you gave earlier of going in for a hearing test, one of the issues that we have is that if an older person has dementia, if they need a hearing test or an eyesight test, making sure that the services are there to support that person. And there are very good examples that we see in colleagues looking at doing the hearing tests, how the special needs for people with dementia and their carers can be accommodated. And finally, the sixth part of the pathway was dying well. We know that there have been a number of excess deaths during the pandemic. There's been a lot of publicity about deaths in care homes. We know that 70% of people in care homes have dementia. And that dying well was particularly poignant in terms of if visitors were not allowed to see someone in a care home who was dying. You can imagine the additional worry and stress and distress that something like that would cause. We know that towards the end of life, the delirium that people who have COVID can be quite severe, and we would see people becoming very ill and dying within hours of becoming ill, and that was a huge stress to the carers in the hospital, but particularly care homes who were faced with managing and supporting relatives. So the aspect of dying well, not a terribly nice thing to think about, but the aspect of dying well was something that we thought was extremely important as well. So that's just a highlight of some of the things that we did at a national level through the pandemic. So that was all that I was going to say. We've got a chance. Perhaps Chris and Jenna, if you could unmute yourself, and yes, we can see you again. So what I thought I would do, no one's put any questions in the chat. So what I would do is, I'm very happy to unmute everybody. It means that we have a lot of background noise, but it gives the people the chance to, if you want to selectively mute yourself, that would be great if there's noise in the background. But would anyone like to put their hand up, or I think if you hover over, Jenna told me yesterday you can get a thumbs up if anyone wanted to do that, or if you just wanted to shout a question, if you could say who your name is, that would be fantastic. Could I just say this is a high-risk strategy? I don't know if it'll work, but let's give it a chance because no one has put something. A deafening silence. So, Chris, if I may, what I'll do is because there's a bit of background noise, I'll ask people just to mute themselves there. Now you can unmute yourself. Chris, in terms of looking at, is there evidence that deafness is a risk factor for dementia? I mentioned the Lancet Commission, and is there anything from your work? And as I say, if we could just have some quick answers, just in case people come in with chats. Deafness a risk factor for dementia, true or false, Chris?
Yeah, well, it's potentially a risk factor. I mean, it's the whole question of causality, isn't it? We know that I think it's the highest in terms of the risk factor being identified. It's got the strongest association with dementia. So potentially, it's the one that is the is the most potentially modifiable risk factor for dementia. The issue, of course, is causality. Are you getting a hearing loss because of the same neural changes that cause dementia, or is it the fact that your hearing loss, and perhaps because your ability to interact socially and all these other things to keep your mind active, as it were, are impaired? Is that the mechanism? So we don't know that. That's something that Jenna and I want to find out. I think Jenna actually knows much more about this than I do. So I'm going to dodge the bullet and pass on to her.
It was a vaguely political question, and Chris, you might want to come back to this, but should we have a national hearing screening programme to detect dementia and hearing loss? Jenna, what do you think first of the association between them?
So very, very much like Chris has said, and if anybody has read the Lancet Commission, the 2017 or the latest one, yeah, there, you know, hearing loss has been, as that people have thought that it's the largest, has got the largest potentially modifiable risk factor. Like Chris said, we can't infer causality. So although we can see that hearing loss, and even in our results, hearing loss and cognitive function appear to be linked, we don't know it's the hearing loss driving that. But further to that, the fact that it's a potentially modifiable risk factor, we don't actually have the evidence to support that either. So we don't actually have the evidence to be able to say that by modifying hearing loss, which again, you know, we can't modify hearing loss at the moment. We can treat the symptoms of hearing loss using hearing aid or hearing management courses. So we're not actually modifying the risk. So there's lots of people saying, well, if hearing loss causes dementia, give someone hearing aids and that will reduce the risk. And it could do, potentially through lots of different mechanisms. But again, we don't actually have the evidence to support that at the moment.
In my experience, seeing someone from that is that if you take the wax out their ears, that's the most useful intervention that you can do. So I guess it's part of ear health that you would say that's helpful. Chris, I was going to ask, in terms of the information you presented, is that why, as an elderly person myself, I'm not going to let that go, as an elderly person myself, is that why I can remember certain songs? And is there something about the way that the hair cells encode memory for music? Jenna, you might have an idea on this as well. Is that why people can remember songs and not other things?
No, that's more to do with what's going on in the cerebral cortex, I think. So the different parts of the brain are more susceptible to damage, perhaps. So that sometimes, I mean, there are classic cases of people who have lesions to the brain, so they have damage to the brain where they lose the ability to speak, but they can still sing and things like this. And so, but that is very much sort of a high up sort of cognitive function, I think, normally. So the sort of changes that you get, you know, in the, you know, what we call the auditory system lower down in the inner ear and in the brainstem, are more affecting the fidelity of the representation of the sounds that are out there.
Right.
So as you lose that fidelity, you are more likely to mishear things, and you won't hear music. I mean, one of the things that we've shown, actually, if you're interested in music, is that study I showed you where we measured the neural response to the perfect fifth, you know, this musical chord. And we showed it decreased with age. And what we found is that older people also behaviorally, they're less able to distinguish between consonant and dissonant chords in music. And this gives a lot of the sort of tension and pleasure from music comes from that. So there's definitely something deteriorating quite dramatically as you get older. But the important point I was trying to get across is these are things that are all kind of hidden in some way because they don't show up in conventional audiometric testing. And so what Jenna and I are trying to do is see if some of these things are actually could well be very subtle biomarkers for cognitive changes as well. So we're thinking that our sort of window into what's going on in the ear could tell us, give us an early warning, perhaps, that the cognitive decline is beginning. So that's something that we're hoping for in our research.
That's very helpful. And Jenna, we're out of time, but if I could ask just a quick one as well. The findings that you had, fascinating to see the effect of COVID. I wonder if quickly, Jenna, you could say, did those findings surprise you? Was there anything in those findings that surprised you?
We did. We expected that we probably would see this association. So we know from past research that hearing loss is very closely linked with increased rates of mental health. But what we find the most interesting, what we're kind of hoping when we look at the bigger picture of the research and when we do it all, is to really have a look at the effect on cognitive function. So to how all these factors might interact together to affect cognitive function, to try and understand this mechanism with this risk. You know, if hearing loss increases the risk of cognitive function, could it be through this mental health pathway, slowness? So that's what we want to have a look at.
Great, that's very helpful. There was one question from Samrina, and I would just like to say that, and either Chris or Jenna, other studies where a temporary repression of one sense can improve hearing. And yes, it's very interesting. I remember some elderly people saying to me, if I wear my glasses, I can hear better.
That's a slightly different thing. I'm sure that one is probably to do with lip reading.
Exactly.
So when we speak to each other, we
and
lip reading, yeah.
Samrina, you have just appeared on the screen and you're waving, thank you. So is there any sense, I mean, the coexistence of the two, and Chris, is there, or Samrina, do you know of any studies? Chris or Gemma, any studies where if you press one, you improve the other?
So I don't know anything short term, but we do know that people who've had, say, a visual deficit, their hearing ability becomes greater than it would be for someone who has and regions of the brain that were devoted to visual processing become devoted to hearing, and particularly in terms of spatial awareness. So blind people listen out for little audible cues that help them navigate a space. And I don't know the other way around, but I imagine that the similar situation is the case the other way around, that
almost a kind of retraining.
Someone who's deaf might have superior visual skills as well, but I don't know. But I don't know about any sort of temporary manipulations.
Okay,
it'd be a hard experiment to do. To convince someone.
Samrina, what was behind your question?
So 2 days ago, I watched a Bollywood movie where an artist, a pianist, as a matter of fact, used to blindfold himself so that he could concentrate better on music. And so he wasn't blind, but he practiced blindfolding himself, literally, so that he could focus. And as a musician, he believed that he performed much better when he could totally focus without, so basically in the movie there was a cat that constantly used to distract him, so but the idea was that he would prevent any sort of distraction and increase his focus and concentration levels. So I'm thinking perhaps there is a way that we can actually train our brain as well by practicing or incorporating these small techniques, or we could potentially suggest to somebody else that momentarily close your eyes, focus a little bit more. I think so my mom is only 50 something, but even she has this problem where she's borderline and not specifically deaf, but borderline deafness, and she sort of is clinically not deaf basically, but we always observe that when you're facing her, you can she'll lip read, she'll immediately understand, but if the noise is coming from the side or so, then she's got to figure out things, so I was thinking, maybe temporarily repressing something, just you've got to practice it yourself, of course, might help increase in another sense.
Yeah.
That's
Jenna?
I was just going to say, I mean, it does seem very fascinating. I don't know, like you said though, whether the music, and Chris might be better at doing this, might be more of an attentional thing. So this is more like about feeling the music and hearing it and playing it, not being distracted. Because there's lots of things looking at like auditory training. So for older people, to kind of improve their auditory system and listening and noise. And that doesn't necessarily involve repressing any other senses. It's just focusing on, and learning how to tune into that sense. In my kind of very unexpert opinion, it probably might be more an attentional thing rather than the fact that he's actually not using his eyes at the time. I don't know. What do you think, Chris?
Well, I was just going to say, I think, we talked a little bit when we were just having a chat with Alistair about the importance of lip reading. And what we don't realise is that everybody lip reads if they can see someone's face. It's one of the problems with face masks, which is one of the unintended consequences, is that people's hearing ability is really bad. Firstly, because the sound is muffled, and also because you can't lip read, and that's really problematic for people with any kind of hearing loss, but also people with normal hearing lip read all the time, and it really helps us. So one of the things that the brain needs to do is to integrate the different senses. You get a much more accurate picture of the world if you can integrate the senses. So blocking off one sense, it might help in terms of removing distraction. But I'd say if you have both senses working, you really want to train the brain to integrate them to get the maximum information you can from whatever environment you're in. So I'd be a little bit hesitant. I don't know of any studies, so it's not really my area. But yeah.
Sabrina, thank you very much for the question. It stimulated a lot of discussion, and perhaps there's a study there. Perhaps would fund it, Chris. And
Yeah.
somebody know what was the name of the film?
Oh gosh.
Right.
I'll have to find it and interpret it.
It was a test of memory, but that would be the title of the study. I'm conscious that one of the few jobs that one has to do as chairman is to keep people to time, and I've spectacularly failed in that. But I think the conversation was a bit late, but I hope people don't mind that we went a few minutes over time. So if I could just thank very much Chris and Jenna for fantastic presentations, for everyone for attending, and also particularly to Suzanne and to Kerry for the organisation of the webinars. There are ones coming up, so we'll be in touch about when they are. Thank you very much for your time. Enjoy the rest of the day.
Yeah, thank you, Alistair. Thanks, everyone.
Bye.
Bye.